I'm the executive director of the Campaign for Public Health Foundation, and we are trying to make sense of the debate on funding here in Washington these days. As background, I wanted to let you know that the CPH Foundation has tracked federal funding on prevention each year for the last several years, focusing primarily on the core funding of the Centers for Disease Control and Prevention. So these are the core budget lines, and across the line we've tracked this since 2005, which originally that core program line in 2005 was $6.321 billion, and then across to today that funding has leveled out at $6.7 billion in FY 2010 and 2011. This funding year has been very difficult to track, and so we actually have a chart that we'd like to show you that makes it a little more comprehensive and understandable. So this is a much more legible graph that we've made based on our earlier chart that we showed you. And if you can see the cursor, it follows across this black line the funding level that's been implemented for the core programs of the CDC. These yellow circles down here and these red circles were presidential budget requests originally, starting in FY 2006 forward, and the black line tracks what Congress eventually enacted after considering the president's request, and this dotted line up at the top is actually inflation. And what that means basically is that the CDC's budget has never, since 2005 anyway, kept pace with inflation. This Congress now will need to fund the federal government from March through the end of fiscal year 2011, which ends on the last day of September. And so the big debate now is where this funding will fall. Yesterday, on February 9th, the House Appropriations Committee released this statement on their proposal for a continuing resolution for the remainder of the fiscal year. And as you can see in the headline, it talks about the funding cuts, spending cuts going deep, and goes on to detail that these cuts are important for balancing the budget. That website is appropriations.house.gov. The press release also includes a list of proposed cuts that would total more than $74 billion, including $58 billion in non-security discretionary spending reductions. And if you look down through the list, we were trying to discern where CDC funding would fall, and you can see here at the bottom of the page there is a proposed cut to the Centers for Disease Control and Prevention of $755 million. It doesn't say exactly where those cuts would come from, but they do mention in the beginning of the press release that this is discretionary spending, which the bulk of the core program lines of CDC are discretionary spending. The only other major line is a mandatory line for the Vaccines for Children program. So to the best of our guess, most if not all of this funding would come out of the core program lines of the CDC. Unfortunately, this is all that's available in terms of details. One interesting note is that it states here at the bottom, all reductions are compared to the President's fiscal year 2011 request. If you look on our chart, this section here was President Obama's initial request to the House and Senate. And what we did not show on this chart at the time was a proposed $250 million reduction in his initial request that was proposed in August. So there was an amended request. I called the committee earlier today and asked which request they were referring to, and they informed me that it included that $250 million cut. So what we've done now is try to put all the numbers down in a single place, and you can see, as mentioned, that CDC's core program line in FY 2010 was $6.7 billion. The initial president's proposal which actually proposed a cut to the CDC of about $131 million, was his initial request was $6.611 billion. The revised proposal then that I mentioned in August cut an additional $250 million from that FY10 number. And this is the number that the committee has told me this morning that they're using as the basis for this additional cut that they've proposed. So here would be the number for the CDC's core programs if the House Appropriations Committee proposal were to move forward through the legislative process. The total cut from FY10 then would be $1.136 billion, leaving this number here at 5.56 would be the total cut below 2010 funding levels. The nearest I could find in any historical tables would be 5.52, which was enacted by Congress back in 2003. So this budget would actually numerically cut back CDC to 2003 levels. A last consideration, however, would be inflation. And as you can well imagine, 5.61 billion back in 2003 is not the same today, and so we've gone to the Bureau of Labor Statistics calculator for the Consumer Price Index. This is just basic inflation, not medical inflation, which is higher. And what you find is that 2003 levels of 5.6 billion would actually have been 6.65 billion in 2010 dollars, presumably a little more in 2011 dollars. So this proposal from the House actually cuts the CDC's core program lines back to pre-2003 levels if you add inflation. Please visit our website, and if you are so inclined, we certainly welcome any donations from the public to help us continue our work.